themselves. We are coming to you live from the heart of Uasin Gishu County. We are at the Mama Rachel Maternity Hospital in West. This as we bring you where we are in terms of healthcare. And on set with me is Dr. Paul Wangwe, Chief Officer for Preventive and Promotive Health, and Evans Kiprotich Daktari, Director of Health Services. And a little bit later, we will be joined by the CEC Health Services, Dr. Abraham Serem, on set as we talk about healthcare in this county. Remember, this is important as one of the boxes that had to be ticked before being given that charter to be a city. Gentlemen, welcome on this stage as we continue to have this discussion. And I just start with you, Dr. Paul Wangwe. Now, as we talk about healthcare in these town, soon to be a city, how prepared are we in terms of dealing with healthcare pressures that we continue to experience? Because once we become a city, more people will want to come seek healthcare, because it is already happening, because Uasin Gishu County is considered to be one of the counties that is proper when it comes to matters of health.
Okay. Thank you very much. My name is Dr. Paul Wangwe Ongeti, Chief Officer of Preventive and Promotive Health, Uasin Gishu County. I would wish to first and foremost say that Uasin Gishu County has a town in it, Eldoret City, which is strategically located. If you look at the location of Eldoret, that makes it more of a medical hub, besides its human resources for health, is its location. Uasin Gishu, Eldoret City joins Kapsabet Town, Bungoma, Elgeyo Marakwet, Nakuru. So when accessing most of these major towns, you have to pass through Eldoret. That gives it that gives us a pointer that it is strategically located. Then again, in terms of population and other amenities, we have a higher population than other neighboring towns, more amenities than other neighboring towns. Us having level 6 hospitals, which are both private and public. We have a public level 6 hospital, and we have a level 6B hospital, which is private. We have a total of 276 facilities, both private and public, in Eldoret City, which is housed in Uasin Gishu County. Out of these, 140 of them belong to the government. So in terms of accessibility, I can say that we are fairly well done in terms of accessibility. In terms of human resource, we look at the number of consultants we have living in this city. We have around 54 consultants living in this city. All medical officers combined, both public and private, we are talking about 450 medical officers. And when it comes to nurses and other professions, I feel like we are well resourced when it comes to those issues of human resource.
Yeah. And Dr. Evans, now when we talk about matters to do with healthcare in the county, that falls directly under your docket. Now, here is a question of improved service delivery to the people that the governor continues to beat his chest, saying that we've actually done well under Nguzo number 2, which is on matters to do with health services. So in terms of just getting ready and also improving service delivery to the people, where are we with that? And with the city status coming into place, what's the vision like on matters to do with healthcare?
Okay, thank you. My name is Dr. Evans Kiprotich, the Director of Health. Now, when it comes to mother's health, let me say this, that we have the supply side of health services, and we have the demand side of health services. So I'm looking at both what the Chief Officer has just said, that how many consultants we have, for example, how many hospitals are there at the different levels of different levels of hospitals. That we have the level 6, we have level 5s, level 4s, level 3s, level 2s, and you go all the way down to the community health promoters, which is the level 1 in government. So if you want to look at the quality of health care service, you look at the levels of care we have, in addition to what sort of quality service, or what we term as quality in health. Say that, do I have the relevant consultants to provide the service? Do you have the relevant nursing care to be given to the staff? Do you have the relevant investigative or diagnostic equipments for this. So as a county, this is what I could easily tell you, that we are ready to do this. We have enough. You heard from the chief officer the number of consultants we have here. Look at the number of hospitals. We have the Moi Teaching and Referral Hospital as a national hospital. We have the Uasin Gishu District Hospital, the West Maternity Hospital, basically to cover the tertiary level of health care, because this is the tertiary level. So we have those. As a county, for example, we have our own 6 level 4 hospitals, which are there. In every sub-county is there. Now we have additional, like the Mama Rachel Ruto Hospital now, where we are, the maternity hospital, still to provide that particular service. So if you look at the maternal care or maternity services, we could easily tell you that we are here. We have so far, this is a new facility we opened like 2-3 months ago. So far we have done almost 50 cesarean sections here alone, with more than around 30 children in NPU. These are new things which are coming up. Go to the field. In Ban Forest, for example, obviously we have the X-rays which are there. We have orthopedic surgeries going on there. We have maternity and obstetric care going on that particular side. Go to see the SIWA, we have dialysis as a service, as a quality of care, which is there. You go to come to here now, we have the West Maternity. We have a unit in the next Ruma Sub-District Hospital, which is just within here. So if you look at that from the supply point of view, we have a good number. I would rather tell you that the number of nurses within the county is almost 500 plus, county staff only. I've not counted plus the private sector. So I think to us, from the supply side point of view, we are ready.
Now, Dr. Paul, when you talk about, he's talked about the supply side of it. Now, there is the demand aspect of it. And in terms of just some stats that I've managed to pull out now, in terms of preventive and promotive healthcare, we have HIV prevalence that has gone to 3.7% from 5.5%, and this goes to show the initiatives, some of the safeguards that have been put in place by the county in making sure that that we achieve these numbers that we continue to experience. Also, gender-based violence center has been put up in this county. Just how important or how significant is it for the leadership of this county to ensure that its people are healthy, that even moving forward as we become a city, that we are not only a city that boasts of infrastructure, but that its people can smile very well because a dental unit is there, they can see very well because there is an eye unit, and that even all these other diseases are being managed very well.
Thank you very much. What I would wish to say, under the leadership of His Excellency Jonathan B., he has managed to actually set out different programs, especially in HIV and AIDS, that we have managed as a county to reduce the prevalence of HIV from around 5.8% to 3.7%. That is as per the recent data. What we do is, of course, advocacy, continuous testing and counseling, of course, supported by partners with like USAID and AMPATH. What we do also as staff is we would wish to reduce stigma as much as possible. That is on the part of HIV. We are also trying to talk to the dwellers and tell them that there are these other issues like the commercial sex workers. We are trying to contain the issues and making sure that everything is done in an orderly fashion and everything is preventable. We, as a county, are providing the resources that should be available to minimize the prevalence of HIV. Then secondly, when we talk about oral healthcare, as you have mentioned, in all our sub-counties, His Excellency the Governor has set dental units, state-of-the-art dental units, and therefore something that has never been there before, and now all our residents can access. So we will have reduced migration from the villages to town to seek basic health care, like the specialized eye care and dental health care. Yes.
Yeah, and also when you talk about such matters to do with the renal unit at Ziwa, we have also the Ziwa maternity, which brings the question of devolving matters to do with the healthcare within the devolved unit. That is making sure that these services, these facilities get to the grassroots where the people are. We also have the CHPs who have been put in place on matters to do with the healthcare. That is the community health promoters who have been put in place in this county. Therefore, as we continue to just talk about these now, we also have the renovations that continue to be experienced in this county. Vaccination of fridges worth 100 million put in place in this county, as well hepatitis surveillance. All these matters to do with healthcare in this county. We say that for a healthy and happy people, we have to have people who are healthy pretty much. And therefore, as the governor continues to also boast of Nguzo number 2, which is healthcare, we not only see it just being a policy, it is a matter of it being of it being a fact that they are implementing the same in making sure that it not only just remains as a policy, but it is actually work on ground in making sure that we achieve these. Therefore, as we have this discussion and the county being declared the city, Eldoret town being declared the city, one of the pillars that had to be achieved is matters to do with healthcare. Therefore, it is important for us to continue having this discussion on matters healthcare. And on set with me, who has just joined us, is Abraham Serem, who is the county executive member for health services. But I will come to you, Evans, as we continue to talk about this. Now, with all these improvements that we continue to experience, how do we make sure that these services get to the people? Like you've rightfully said, there's no need of migration into town, but making sure that people have these services. How is that also being supported and promoted by the CHPs?
Okay, thank you. One of our major objectives of health is improving access to healthcare. Improving access means each and every other individual, wherever they are, is capable of accessing services within 5 kilometers. So by so doing, it means that we make sure that even the facilities at the ground, the dispensaries, the health centers, are fully equipped as per their level, and staff, the human resource, we make sure that they are there in almost all the wards, that wards within the county. Number 2 is the fact that so far we have 2,005 community health promoters who are there now. One of their major issues is to link the community to the facilities. In fact, we are going through the process of registering households to make sure that these households, when they are registered, they are linked to the nearest community health unit, what we call a SPOC. Remember, we are talking about the hub and the spokes. The spokes are the facilities being served by one major facilities within that particular region. So for us to improve access, just like what the chief officer said, for example, in HIV, we are going to sensitize the community members through the CHPs. For example, the other day you heard of the hepatitis A, for example. We were using the CHPs to make sure that we've reached out to the particular households to educate them on, health information, the health education related to the particular condition, related to HIV, related to TB, related to malaria, related to family planning, immunization, and the others. By so doing, we've seen an increase in immunization coverage. We've seen an increase in family planning usage, for example, an increase in toilet usage, or the number of households with toilets, for example, in the issues of sanitation. So what we have done is we are improving access. At the end of the day, patients might not necessarily need to come to the main hospitals to be managed, but they can easily be managed at the grassroots. Now, if there is an issue there, it needs to be referred upwards. We also have good ambulance systems with call centers to bring those patients to the main centers where they're going to be managed. So I think these goes hand in hand, and it does a lot. Let me add one thing. These community health promoters are not just there for health education and all that. On top of that, they can easily take your blood pressure. They can easily take your temperature. They will tell you something about food and nutrition. They will tell you about why do we need to immunize. So at the end of the day, access is improved there. And then, in fact, if somebody is sick, they can easily be captured in the hospitals. You had a chief officer saying, HIV, we have reduced the prevalences. TB, we got the highest number last year. Hopefully this year, the number of TB cases we are going to diagnose is also called half. Because we, apart from them being there, we also go to the community level as outreach. We have outreaches within. In every hub, we have outreaches. In every spoke, we still have outreaches in areas we realize there are challenges here and there.
And Bonasi Isi, welcome on set. Now, as we continue to talk about accessibility to healthcare, there is the matter to do with expansion of the services as well. There is the question of the county and where you sit, and in terms of budgeting and making sure that these services are easily accessible. From where you sit in terms of also just being ready for the city status, where are we? Are you saying that in terms of healthcare, Uasin Gishu County is ready, Eldoret Town, tuko sawa, we are a healthy city?
Yes, thank you. I'm Abraham Saram, CC for Health Services, Uasin Gishu County. From the onset, I must say, Uasin Gishu County welcomes all of us, everybody in the nation, to join us in celebrating the new city, I guess the most new in the planet. And one thing I must inform all the viewers is that Eldoret City is ready. Is ready because our healthcare system is at its best. We have motivated staff. We budget enough resources to get enough drugs. We have enough to do all the services from the county government's perspective and the governor's perspective. The town is ready. Around this town, we have several government-owned facilities, plus even private-owned facilities. Remember, Eldoret is known for medical tourism. We have level 6 facilities, which are 2 around town. We have the MTRH and the Eldoret Hospital. We have the level 5 facilities. We have 5 level 4 facilities. And all these facilities offer specialized services. We have also the other health centers which are around town. One thing I must promise, and which is happening, is we are ready for you. The government, the county government of Uasin Gishu is ready to deliver optimal service, prime service to everybody across the country. Thank you.
And I want to see a little bit later, I think I will want to bring the question of making sure that even those working in these hospitals are happy. We know the other day we experienced the worst medical workers strike in this country. So as a county, how are you handling that? But I think I'll come to you, Dr. Paul. Now, Dr. Paul, you are in charge of preventive and promotive healthcare. Briefly, just take us through the numbers that you have seen before and how best you are working to ensure that whilst you diagnose more, that we are also preventing more cases from coming up.
Okay. Thank you very much. In preventive health, we seek to prevent this patient from getting to hospital. So we look at very many things when we are doing this. We look at nutrition, we look at advocacy, we look at health education. So as a county and as a department, we go to the people and we ensure, just as the director has said, we ensure that these community health promoters pass the message to the people. This prevents these people from coming to hospital. Of course, we have a robust system of malaria control. We have school health program. We have a school health program where we go and ensure that all these children at the ECD level are dewormed. We have vitamin A supplementation at the lower levels. And also we have the in-school brushing, which we have started. And the only other place I'm proud to say that it's been done successfully is in Mexico. Uasin Gishu is the only county in this planet, second to Mexico, that has successfully rolled out this program, which has been able to reach 40,000 ECD learners together with their parents. And also these ECD learners are able to get brushing kits. So we have a complete school health program for the ECDs. That is vitamin A supplementation, deworming, in-school brushing, and general health education. So at this early age, we are able to prevent, to have a health-seeking behavior in these children. That is why you also see His Excellency, the Governor, targeting the ECDs by providing learning materials, their school milk. So we look at nutrition also from the Department of Education. As we work as a county in a multi-factorial approach where we do it interdepartmentally. So it is not only the Department of Health that works in prevention of disease, but also other departments.
And yes, indeed, they say that here in Uasin Gishu County, matters to do with health is actually second to Mexico, second in the planet on matters to do with in brushing, exercise in schools. That we continue to talk more even as we prepared for this county to be conferred to be a city